We'll wait just a couple more minutes just to see if anyone joins, and then we'll get started. Just a little bit longer. Okay, we'll get started. Hi, first of all, my name's Josh. I'm a sports therapist here at On Your Game Physiotherapy. And today we're going to be talking about hands-on therapy and is it worth the hype. So basically, what we're going to go through in this presentation is what hands-on therapy is, the purpose behind it and why we do it, and kind of what it is that we'll be doing when we're treating you with hands-on therapy, and then basically trying to answer the question, is it worth the hype? So to start off, I'll just to explain a bit about what hands-on therapy is. So it's a really commonly used method by therapists that helps to relieve any symptoms that an individual may be feeling. So whether it's pain, whether it's a loss of motion, so loss of range at a certain area, and yeah, we're sort of just hands-on therapy looks to address those. So some of the types of hands-on therapy that you yourself may have experienced include massage, acupuncture, joint mobilizations. If any of you have gone to go see a chiropractor or an osteopath, you might have had cracking and stuff like that is sort of what we deem to be and what is hands-on therapy. And it works on a various amount of things. So treatments like massage and acupuncture, they'll work on more of the soft tissue, so more of your muscles and your ligaments, and trying to relieve and get rid of any adhesions or knots that you have in that area in the muscle, and that can be really useful affecting your pain, so relieving you of your pain and trying to help sort those symptoms out. And also if you feel any tension, so that can come from whether it's you're working at a desk all day and you're typing constantly, or it could be you're stiff from going to the gym and maybe playing some sport. Massage can be, and acupuncture can be a really useful treatment for relieving you of those symptoms. And treatments such as mobilizations or the cracking that you might have heard of or even experienced yourself, that's more working on hard tissues, so your joints more so. And basically what that's trying to do is around so in your body, most of the joints are called synovial joints. What that means is they have a capsule around them, and that's made of soft tissue, and in that capsule, you've got what's known as synovial fluid, and that helps to keep the joint lubricated and keep it moving freely. And what mobilizations do is, if there's a joint that's not moving as freely or that's painful, and it is because of a restriction in the capsule, so the capsule might be tight, what mobilization can do, and it can help to loosen that capsule and help to promote movement in that area. So that's some about what different types of hands-on therapy there is and how it can help your symptoms. So what we'll go on to now is the benefits. So like I said, it can help relieve you of your symptoms. So if you're in pain because of, you might have pulled a muscle in your back, or you notice that you can't get your arm up out to the side as far as you used to, hands-on therapy can help to sort of enable and reduce the effect of those symptoms. However, it is only a short-term fix. So research has shown that actually hands-on therapy is really good at reducing your symptoms over the short term. So looking more a couple of days to a week. So those of you who have been to your chiropractors and your osteopaths and you've had your spine cracked, you've probably noticed, I'm pain-free and I can move a lot better for a couple of days after, maybe even a week after, but then you slowly start to feel those symptoms again. So it's really good at that short-term symptom relief. However, it's not going to give you a long-term fix. So it's treating the problem, but it's not treating the cause. And that's something that, other techniques alongside your hands-on therapy, other techniques are going to help treat the cause and not the problem. So also, you can get a psychological benefit from hands-on therapy, particularly with your massage and acupuncture. So you can find for those of you that have had those treatments, you can find, it can help to relax you and sort of put you in almost like a meditative state, and due to the hormones and chemicals that are being released from that treatment. And so yeah, there's a lot of good benefits, but like I say, it tends to only work in the short term. So how do we get a long-term fix using hands-on therapy? And basically it's through added techniques. So whether it's, you come in to see us because you're in pain in your neck, and you work behind a desk, you might have a lot of tension in that area. So something like massage or acupuncture can be really good to help to relieve that tension short term and help you get out of pain so that you're able to work. But with stretching exercises and maybe strengthening exercises, you're fixing the problem and and the cause as well. So the cause could be, from your hunched over. So if we can sort and work out your posture and try and help to, have you sat up and get those neck muscles strong so that you're not constantly straining and, your neck's not constantly looking down, we can fix the cause and we can help you with those issues long term, so that your pain doesn't come back. So similarly, it might be, you've got an issue in your shoulder where your range isn't quite as good. So we can do some joint mobilizations to try and help facilitate that movement at the joint, but with stretching and exercises that can help work on your range of movement, say in the gym or at home. Alongside those mobilizations, we can really sort of push for that long-term fix to the root of your problems rather than just addressing the here and now. So it is, it's really beneficial, but it's not beneficial, but on its own, it's not going to it's not going to help you in the long term. And also with hands-on therapy, people who come in to see us, they can see it as it's a more passive type of movement, and so and therapy, so people can become to rely on it and think, oh, this massage is going to get me out of pain, or this mobilization is going to get me out of pain, and then you can just keep coming back and seeing someone because it does work and it does get you out of pain. However, it's maybe not something that is going to help you in the long term, like I said. And so we want to work on those active modes of therapy. So getting you stronger, stretching to release the tension rather than just relying on these massages that can give you that short-term fix. And so I think it's really good that we understand what hands-on therapy is good for, and the benefits that it can give you, and the way that it can help you on your journey to recovery, but not rely on it to give you that fix, because, as I keep saying, the long-term fix is not going to be there if you're just relying on things like massage and mobilizations and acupuncture to help you get out of pain. So I think big takeaway messages is it's a really good mode of therapy, and hands-on therapy really helps you and really you can see really good results from people who are in pain and people who have got injuries. You can see really good results from them with hands-on therapy. But it's when you're getting hands-on therapy alongside your stretching and strengthening exercises and your range of motion exercises, that's when you see the best results, and you see people who were in pain and then 6 weeks, 8 weeks down the line, they're not in pain anymore and their pain never comes back. So I think, so is it worth the hype? Yes, but maybe not as much as it's portrayed on social media and portrayed by certain people. So I think it's something to always keep in mind. If you're feeling in pain, if you're noticing that you're getting less movement out of one joint compared to the other joint on the other side, come in and see us, book in with us, and we can give you an assessment, and we can look to see whether hands-on therapy is the right therapy for you, and then we can hopefully look to get you out of pain in the long term so that the problem never comes back. I hope you've enjoyed it. Is there any questions at all from anyone? If you do have a question, feel free to write it in the comments. No? Okay, great. So like I said, any issues at all, give us a call and we can book you in and try and get you sorted. Great. Have a good one, guys.